So the final exam for DMS 100 is cumulative, which means it is going to cover all of the chapters, or all of the modules from the beginning of the semester to the end of the semester. So we're going to go all the way through from X-ray and the intro chapter all the way to radiation therapy. So I highly recommend going through the PowerPoint voiceover and also doing the Kahoot. Not everything is going to be covered in this review. The Kahoot is still going to be a good review for any additional information. So to start out, who invented the different modalities? So it's really important to make sure that you know who invented X-ray and CT. So the inventor of X-ray was Wilhelm Conrad Röntgen, and he discovered X-rays in 1895. And X-ray was actually the first modality discovered in the field of radiology, which is also important to know. CT was invented by Godfrey Hounsfield in 1972. So I would highly recommend knowing who invented it and the year as well. So CT was invented by Godfrey Hounsfield in 1972. These are some of the acronyms that are really important to know as well. All right, so what do the following acronyms stand for? We use acronyms quite frequently in the medical field, so it's important to know them, and also you need to know what they evaluate. So CT stands for computed tomography, and it evaluates anything essentially, bone, brains, abdomen, pelvis, chest. I mean, the CT scans are very good at visualizing all kinds of different anatomy. BE stands for barium enema, and it evaluates the lower gastrointestinal system, or the colon. UGI stands for upper gastrointestinal system, and we're visualizing the distal esophagus, the epigastric region, and the stomach. The IVP stands for intravenous pyelogram, and that evaluates the urinary system. So we're looking at the kidneys, ureter, and bladder. And then MR stands for magnetic resonance. It can be MR, it can be MRI, which is magnetic resonance imaging, or MRA, which is magnetic resonance angiography. And remember, with MRA, we can look at the blood vessels without using contrast, like in interventional radiology. And then NM stands for nuclear medicine. And nuclear medicine can evaluate many different body parts. Remember, there's over 100 different exams for nuclear medicine. So it can evaluate the musculoskeletal system, cardiovascular system. There's, over 100 different exams. So I'm not going to go through and break all those down. But so what exam is this, and what is the prep? So this is an OB ultrasound. You can see the baby right here, right? In the sac, little feet, hands, head, the spine here on the back. So what's the prep for an OB ultrasound? An OB ultrasound, the prep is 32 ounces of water 1 hour prior to scan time. What exam was performed on this patient? This is a double contrast barium enema. Remember, the acronym is BE. There's two contrasts that are used. That's why we call it double contrast barium enema. We use barium sulfate, which is the contrast that's used, and there's a second contrast that we use, which is air. Sorry, I know I'm hesitating a lot, but I'm trying to give you a chance, if you're going through this with me, to answer the questions. So the two preps that are used for a double contrast barium enema are barium sulfate and air. What is the prep for this exam? Well, we're looking at the colon, right? We're looking at the lower gastrointestinal system, so we want to make sure there's nothing in there, right? No waste, no fecal material or anything like that. So what do we have to do to clear that area out? One, we want to make sure that patient is NPO for 8 hours. We want them to have a laxative and a possible enema. because we want to clear that waste out of there. When they come in, there should be nothing left inside that lower gastrointestinal system. It should be to the point where when they go to the bathroom, it's watery stool. It's just actually clear watery. There's nothing in it. I know that sounds bad, but it's fact. So what exam was performed on this patient? This exam was an upper GI, a UGI, which stands for upper gastrointestinal. And again, we want to make sure that the stomach is completely empty. We don't care about the intestines, so for this one, we just want to make sure that the patient is NPO for 8 hours, nothing per mouth for 8 hours prior to the scan, because that's going to make sure that the stomach is completely empty. And the contrast that we use on this is also barium sulfate. What exam was performed on this patient? So you can see contrast in here, right? Remember, contrast always appears white on an image. So you can see contrast here and here in both of the kidneys, and you can see contrast here in the bladder. So this is an IVP, which is an intravenous pyelogram, and it's evaluating the urinary system, looking at the kidneys, ureter, and bladder. So because the kidneys lie posterior to the intestines, to be able to see them clearly without a lot of matter or air or gas or fecal material covering the kidneys, ureters, and bladder, we want to make sure that the lower gastrointestinal system is completely clear. So the prep for this would be NPO for 8 hours, a laxative, and a possible enema. The prep for the barium enema and the IVP are exactly the same, because essentially we're doing the exact same thing by clearing out that lower gastrointestinal system of waste. We use a couple different kinds of contrast. The contrast is used to help us better visualize the anatomy, such as organs that we wouldn't be able to otherwise see under normal imaging. So two of the main types that we use are barium sulfate and IV contrast material. So barium sulfate is an oral or rectal administration, so we can either have the patient drink it or we can insert it into their rectum. What color does barium sulfate appear on images? Barium sulfate appears white on images. So the other one is an IV contrast material, which is an ionic contrast. Ionic contrast, remember, can have severe allergic reactions that can lead to death. So that's really important to know. Which one can cause allergic reactions, possibly leading to death? Ionic contrast, or IV ionic contrast. Make sure you know that the different contrasts used for the different exams. For an upper GI, they drink barium sulfate. For a BE, they insert barium sulfate into the rectum, and we use air as the second contrast. An intravenous pyelogram, looking at the urinary system, kidneys, ureter, and bladder, we are going to use an IV contrast. We inject the contrast and it filters from the kidneys to the ureters into the bladder so we can see how they're functioning. CT uses IV ionic contrast and possibly oral barium. And then MRI uses gadolinium. So some of the other modalities that we covered, like ultrasound, does not use a contrast. Mammography does not use a contrast. Nuclear medicine doesn't use contrast. It uses radiopharmaceuticals. So these are the contrasts that you need to be aware of for the studies that do require them. So the other thing that's really important to know is the different preps for exams. So some of the different preps that we have for x-ray. What would be the prep for x-ray? Really, there is none. The patient may need to remove clothing or jewelry or metal, but as far as prep prior to arriving at the hospital, there is none. Fluoroscopy is a little bit different than x-ray. Remember, fluoroscopy, we're looking at the function of the organs, so they're going to have a little bit different prep. For an upper GI, the prep is NPO for 8 hours. We're emptying the stomach out, remember? IVP and BE are the exact same. They're both NPO for 8 hours with a laxative and a possible enema, because we want to clear out that entire lower gastrointestinal system so we can visualize all the anatomy. Moving on to ultrasound. For an abdomen ultrasound, again, it's NPO for 8 hours. We want to remove that waste and then make sure that the gallbladder isn't contracting or there isn't any unnecessary gas or air inside of there. The OB or pelvic ultrasound, both of them have the same prep, and it's both 32 ounces of water 1 hour prior to the scan time. And then the carotid, cardiac, thyroid, and renal ultrasounds do not have any prep at all. In CT, a head CT would require NPO for 3 to 6 hours prior, unless it's an emergency. Remember that iodine contrast we can give can cause nausea and vomiting, so we want to try to keep that patient NPO to eliminate that if we can. But if it's an emergent situation, we'll do the scan without being NPO. Chest is the exact same, NPO for 3 to 6 hours prior, and again, just due to the contrast that we're giving the patient. The abdomen CT is going to be NPO for 8 hours. We want to try to get all of that, waste and food and everything out of the system prior. What's the prep for MRI? Really, there is no prep for MRI, right? We'll have the patient change when they get there, but there's nothing they have to do prior, and possibly take a relaxation medication if they need it, like Valium. Mammography, the prep is a little bit different. So with mammography, they want you to prep by bringing your prior exams with you if you have them, and then also no deodorant or lotions or anything on the breast or underarm prior to the exam, because deodorant and talcum powder and lotions, they can cause artifacts on the images. A lot of the deodorants can make it look like there's little microcalcifications in there, so they don't want you to do that. And then also they want you to wear a two-piece outfit so that it's a little bit easier when you need to change for the exam. So what exam is being performed on this patient, and what is the prep for the exam? Well, first thing we need to do is figure out what kind of exam it is. So this is an ultrasound, and it is an OB ultrasound because this is a baby's profile. It's the sagittal view, so forehead, nose, lips, chin, neck, and chest. Okay, so that's the sagittal scan of OB ultrasound. The prep for that is 32 ounces of water 1 hour prior to the scan time. What is this exam? So first we need to figure out what it is, and then we can figure out what the prep is. So this is an abdominal CT. It's an axial slice, so we know it's either a CT or an MRI. But we can see here that there's the liver right here. So an MRI tends to have a little bit more detail. So this is an abdominal CT. And the prep for that is, we're looking at the abdomen, so MPO for 8 hours prior. And pretty much anything involving the abdomen is going to be about 8 hours NPO. What's the prep for this exam? Well, you got to figure out what it is. Sorry, I know this is a little bit blurry, but you might remember it from the midterm slide. This is, again, an abdominal CT. You can see the stomach, kidneys, spine, and a little bit of the liver here. This patient actually has a renal calcification or a renal cyst on their kidney. So we know this is an abdominal CT. So we know that anything with the abdomen is going to be MPO for 8 hours. What modality produced this image? So this is an ultrasound, right? And that's what you need to know for this question. What modality produced this ultrasound, or produced this image, and it's ultrasound? This is ultrasound Doppler. So it actually shows the blood flow, and it's measuring the velocity of the blood flowing down here as well. So what modality produced this image? Ultrasound Doppler. What modality produced this exam, and what exam was performed on this patient? So the modality that produced this image is ultrasound, right? We can tell by the image here, the fan of the transducer, your acoustic window. And this is the renal pelvis and the kidney. So if it looks like tree branches, think of those renal branches inside of the kidney. So this is a renal ultrasound. What modality is this, and what exam is this? So this is a chest CT, and I can tell that because Remember, on CT, air is black, right? So you can't see anything inside of here, so this represents the lungs. Now this is the heart, and it's a good shape of the heart, and it doesn't always look this clear. So I can tell right off the bat that this is a chest CT based on the black lungs and the heart. So the prep for a chest CT is MPO for 3 to 6 hours. What exam was performed on this patient? Again, this is another CT abdomen. You've got liver, gallbladder, kidneys, some of the intestine over here. So find out what it is. Yep, it's a CT abdomen. This one doesn't ask for the prep, but again, the prep would be NPO for 8 hours. What exam was performed on this patient? This is a standard chest x-ray. So you can tell here the lungs are all black from the air with the ribs inside of there. The prep for this would be nothing. There is no prep. The patient might have to change. What exam was performed on this patient? This is an ultrasound, right? But it's hard to kind of tell what it is, but this is an abdomen ultrasound. So they're looking at the organs in the abdomen. And actually it says it right here, a little cheat, ABD for abdomen. What exam was performed on this patient? So this patient, you can see that barium sulfate contrast, which is white, and then you've got black on the image as well, which is air in an x-ray, right? So white is the barium sulfate contrast and black is air. So this is a double contrast barium enema. You can see this is the large intestine. So they use contrast and air for that. What exam was performed on this patient? So again, we see the black air in there, right? This is a chest CT because we're looking at the lungs. It's just at a different level, so you're not seeing the heart fully in this image. What exam was performed on this patient? This is a hand x-ray. What exam was performed on this patient? So this is an L spine or a lumbar spine. And the way that I can tell this is because when you look at the spine and the abdomen images, they look very similar, but the abdomen is going to be open wider on each side to ensure to include all of the abdomen, and then it's going to be open all the way to the symphysis pubis to make sure that you can include the entire bladder. So because this one's cutting off the bladder and it's coned down on each side, I can see the lumbar spine here in profile. This is the lumbar spine view. So this is L1, L2, L3, L4, L5. And then what modality produced this image? This is a head CT. So some of the different energies that are used in the different modalities are important to know. So what energy does X-ray use? X-ray uses radiation, right? Electromagnetic ionizing radiation. Fluoroscopy uses the same thing, right? Uses ionizing electromagnetic radiation. The difference between X-ray and fluoroscopy that's really important to know is X-ray is just showing the form of the anatomy, and fluoroscopy can show you the function of the organs. So because they're live images in fluoroscopy, you can actually watch the anatomy as your patient swallows or as the barium travels. So X-ray shows form, fluoroscopy shows function. They both use ionizing electromagnetic radiation. CT, again, same thing. It's going to use X-rays. It uses ionizing radiation. What type of energy does sonography use? So sonography uses sound waves, right? We use sound waves to penetrate the body and also a transducer, but that's not really the energy. So MRI, what type of energy does MRI use? MRI uses radio waves and a magnetic field to generate the image. Mammography, again, uses X-ray, it uses ionizing electromagnetic radiation. And then nuclear medicine. What does nuclear medicine use? Nuclear medicine uses a combination of radiopharmaceuticals and a gamma camera. So it's actually using the gamma camera to pick up the radiation being emitted from the patient from the radiopharmaceuticals that are injected. So it's important to know which one of these are coined as harmful. Which one of these would we consider harmful to a patient? Well, anything that's involving radiation is going to be harmful, right? So X-ray, is that considered harmful? Yes, we use radiation, right? Fluoroscopy, is that considered harmful? Yes, we use radiation. CT? Yep, we use radiation. Sonography? No, we use sound waves. There is no research that shows that sound waves can be harmful. MRI, is it harmful? No. We use radio waves and a magnet, so there's no proof that MRI is considered to be harmful to patients. Mammography, do we consider that harmful to humans? Yes, we use radiation. Nuclear medicine? Yes, technically. Even though nuclear medicine shows that after 70 years there's no adverse side effects because we use such a low dose of radiopharmaceuticals, because we are injecting a form of radiation to the patient, it is considered to be harmful. So anything that uses radiation would be considered harmful to the patient. Even though when I talk about it, I always say there's no adverse side effects to this, but giving just radiation on a base level can be considered harmful. So the different registrations for the different modalities. So the registering bodies, like who are these people registered through? The ARRT is the American Registry of Radiologic Technologists, and the majority of the modalities are registered through that. So X-ray, CT, MRI, mammography, angiography, and radiation therapy are all registered through the ARRT. Nuclear medicine, if you notice, can be registered through the ARRT and the NMTCB, the Nuclear Medicine Technology Certification Board. So it's important to know that with nuclear medicine, both of these are registering bodies, ARRT and NMTCB. So a nuclear medicine technologist like John Doe can have the initials CNMT for Certified Nuclear Medicine Technologist, or RTN for Registered Technologist in Nuclear Medicine. So kind of know some of these initials. All of sonography is registered through the ARDMS, which stands for the American Registry of Diagnostic Medical Sonographers. So they can have 3 different initials after their name. So general sonographers' initials would be RDMS for Registered Diagnostic Medical Sonographer. A cardiac sonographer's initials would be RDCS for Registered Diagnostic Cardiac Sonographer. And Jane Doe for vascular would be RVT, which stands for Registered Vascular Technologist. So make sure you know who each of the modalities would be registered through. Is it through the ART? Is it through the ARDMS? Or is it the NMTCB? Or both? And then knowing the initials after them are good. So X-ray would be RTR, which stands for Registered Technologist in Radiology. And then same thing, so on and so forth for CT, MR, mammography. Angiography, the initials CV stand for cardiovascular. Also, make sure that you know some of the directional terms. So proximal versus distal. Proximal means closer to midline, and distal means further away from midline. So an example of that would be the wrist is distal to the elbow, and the elbow is proximal to the wrist. Also, superior versus inferior. Superior means above, and inferior means below. So an example of that would be the femur is superior to the tib fib, or the foot is inferior to the ankle because it's below. Cephalad versus caudal. Cephalad means towards the head, and caudal means towards the feet. Ventral and dorsal aren't used as much in general anatomy. They tend to be used more in veterinary medicine, but ventral means anterior and dorsal means posterior. Some of the imaging planes that we've talked about, make sure that you know. So median, what does median mean? Median is a vertical plane that divides the body into equal right and left sides. So make sure that you know the difference between a medial plane and a sagittal plane, because a median plane is equal right and left sides, where sagittal can be any slice of right and left halves, just not equal. Coronal is a vertical plane that divides the body into anterior and posterior portions. So it's kind of like slicing them through that coronal suture in our head that goes from one ear over the top to the other. And axial also means just dividing the body into inferior and posterior portions. So let me show, I have a slide here so here's your axial slice that's dividing into superior and inferior portions. Coronal slice, which is dividing the body into anterior and posterior portions. And then your sagittal slice, which is dividing it into right and left portions. The mid-sagittal or median plane is equal right and left sides. So this is a timeline. You need to match the modality to the year that these were utilized. So these are not in order. These are not matched right here. So you need to match them up. In what year was X-ray invented? X-ray was invented in 1895. In what year was the gamma camera for nuclear medicine utilized? In the 1950s. What year was ultrasound first used in diagnostic imaging? And that would be the 1960s. CT was established in the 1970s. And then MRI was the 1980s. So it's important to know the years. If you can kind of lay them out, we know X-ray was invented first, right? That was the first modality ever discovered in radiology, was X-rays in 1895. And MRI is the baby. So that was the last one that was invented, which was in the 1980s. And CT came right before MRI, so that was the 1970s. Ultrasound was right before CT, the 60s, and the gamma camera was the 1950s. So try to remember those, because that's going to be something that you're going to need to know for the final exam, is what year each one was first utilized in diagnostic imaging. What exam was performed on this patient? So this is a breast MRI, or I'm sorry, a breast mammogram. My mistake, breast mammogram. What modality produced this image? This is angiography, right? We're looking at the blood vessels right there in the brain. What modality produced this image? So these are bone scans from nuclear medicine. You can always tell when it's a not very clear, low resolution image where they're not giving you great bony detail, that that's a nuclear medicine study. Remember, because nuclear medicine is very low resolution imaging. What modality produced this image and what exam was performed? So this is a MRI. This is a sagittal view of the brain and the neck. What modality produced this image? This is nuclear medicine. So again, low resolution. These are the lungs. This is a VQ scan or a lung scan for nuclear medicine and all the different views. So what modality produced this image? That would be nuclear medicine. What modality produced this image? This again is nuclear medicine. And what exam was performed? This is kind of hard to tell, but here's the chin, and then the neck, and this is a gland. This is your thyroid gland. So this is the exam that was performed is a thyroid scan, and the modality is nuclear medicine. What modality produced this image? This is a angiography study. So remember, angiography is to look at the blood vessels, so you can see all the vessels here. And this is just happens to be a renal scan, so you can see the kidneys here on both sides. But it's angiography because they're trying to look at the blood vessels. What exam was performed on this patient? Well, this is an MRI. They were looking at a mass here in the right fib. It's a lipoma. What exam was performed on this patient? This is radiation therapy. So if you're asked what exam was performed on this patient, this is radiation therapy. This is mapping for the treatment of a brain tumor. What exam was performed on this patient? This again is of the stomach, so this is an upper GI. So here is the white contrast in the stomach, the air in the fundus of the stomach, and it's starting to empty into the small intestine there. What exam was performed on this patient? Again, this is a nuclear medicine bone scan, right? We're looking at a skeleton. We're seeing the hot and cold spots on the patient, but there's not much detail. What exam was performed on this patient? This is an ultrasound it's an OB ultrasound, so you can see the foot. And sometimes if you just look at the image, it'll give you the detail. Right here it says it's an OB ultrasound, and this is telling you that there's a foot on the image. What modality was performed on this patient, and what exam? So this is a MRI of the spine. And actually they've got two kind of spots here. There's one right here and one right here, two little masses. What exam was performed on this patient? Well, this is the lower gastrointestinal system. So this is a barium enema, but this happens to be a single contrast because there's no air in there. See how it's just all white from the contrast? What exam was performed on this patient? Now you see the stomach and right away you think upper GI, but see how much of the barium is in the small intestines here? This is actually a small bowel series. It could be an upper GI with a small bowel follow through because it's showing both of the anatomy. What modality was performed on this patient? This is again another angiography. So you can see all the blood vessels here. They're looking at the kidneys, but the procedure itself is angiography. What modality produced this image? This again is MRI, and we're looking at a very huge mass right here in the femur. What exam was performed on this patient? This is a head CT. And then last but not least, what exam was performed on this patient? This is radiation therapy. Again, this is mapping of the tumor within the patient so they can apply treatment to that area. So that's it for the images and the written review, but I cannot stress enough to make sure that you go through and do the Kahoot for the final exam before you take the test. Especially just a lot of things like simple things where there might be one word off, and when you just quickly read it, you think you know the right answer, but you got it wrong because they just changed one word. So it's going to help you pick those things out prior to taking the exam.